very good evening, everyone. I welcome you all for a Friday lecture, for the Friday lecture series. On behalf of Team CSP and also on behalf of Professor Sangeeta Menon, the Head and Dean, NIAS Consciousness Studies Program. I also welcome Vishnuprasad sir. Now I'll hand it over to Meera to formally introduce our speaker of today's lecture and also about the topic. Over to you, Meera.
Okay, thank you, Niharika, and a very warm welcome to all of you. So today's speaker is Dr. Vishnuprasad. Before I introduce her, I would like to say that the topic of today's lecture is medical pluralism for future healthcare, a researcher's perspective. I think it is during the pandemic times that we must have came across mostly about so many solutions for COVID, and there has been so many discussions also regarding the same. And especially at a time like this, I think it is all the more important and relevant that we discuss something like medical pluralism. And it is an honor to welcome you, sir, today. And ma'am, would you like to say something? Yeah, please go ahead.
Finish, Meera.
Okay, so in that case, just formally introduce Dr. Vishnuprasad as well, and then we'll come back to you, ma'am. So Dr. Vishnu is a researcher trained in cell biology and molecular biology, interested in medical pluralism and integrative medicine for wellness and disease management. He joined TDU in June 2014. He has a keen interest in transdisciplinary research and education in the area of Ayurveda Biology and integrative medicines. Dr. Vishnuprasad's professional qualifications include degrees in microbiology and biotechnology, with a PhD in the area of cell biology and phytochemistry. So, he has several years of research and teaching experience at various institutes and universities in India and South Korea. He is currently leading a team focusing on creating a transdisciplinary knowledge framework between Ayurveda and modern biology for delineating the complex biology of glucose metabolism with special focus on diabetes and obesity. His team envisages that the effective merger of both holistic and reductionist views of biology is imperative for successful health and disease management. He is also guiding PhD students working in the area of Ayurveda biology. So it is indeed our pleasure to welcome you today, sir. So a warm welcome to you on behalf of Team CSP. Now, if
thank you very much. Firstly, a warm welcome to you, Professor Vishnuprasad.
Thank you very much.
Yes, your topic is indeed very important, and I think, as Meera said, particularly gains a new context in the pandemic time we are going through. And this is the time when people have looked at alternate medicine and perhaps different ways of understanding what do we mean by health and disease, and perhaps coexistence itself. So I think it's a very timely lecture that you are giving, and I wanted at the outset itself, thank you for agreeing to give this lecture and to be here today. And of course, Meera has introduced Professor Vishnuprasad, but I wanted also to add one line that Professor Vishnuprasad from TDU has worked with NIAS in bringing up a very interesting transdisciplinary courses in the past. And so the interest Professor Vishnuprasad has in transdisciplinary subjects is amazing. And those kind of courses, I think, are rare to get. And we look forward to such courses. So, so whom we have today is not only a researcher, but is also a good teacher, a good academician, and genuinely interested in research areas which he is working and also in teaching. Thank you. Thank you, Meera. And once again, have a warm welcome.
Thank you, sir. Now, thank you, ma'am, and thank you, sir. And please go ahead with your lecture now. So we welcome you to start the lecture.
Thank you. Good evening, everyone. Hope I'm audible.
Yes, sir.
Thank you, Meera, for that introduction, and also thank you, Sangeeta Menon, for introducing me in a very nice way. And that's, I don't know whether I'm qualified to have all those introduction, but thank you very much. it's a really great pleasure that I could be part of this Friday lecture series organized by NIAS. And I used to, though I am not able to attend all the lectures on Fridays, but I used to follow this in YouTube. So in fact, I consider it's an honor that I got a chance here. And for that, I would like to again thank Professor Sangeeta Menon for giving me this opportunity. Thank you very much. Well, I must also say that, I'm a bit nervous when I started this presentation because of, multiple reasons. One thing is that we have so many students, scholars from diverse fields attending this, and I need to ensure that I am doing justice to my topic of today's presentation. So that's one challenge, I believe. Second thing is that the topic itself, as Sangeeta Madam was saying, this is a very vast topic and it's a complicated one as well. So a person can approach this topic from a diverse perspective, from a social science perspective, sometimes from a disease treatment perspective, and sometimes even from a political perspective also. And, in some instances, some of these viewpoints can be provocative also. So that's why I thought I will say that this is a researcher's perspective, so that I can try to give a little more focus to the topic what I have selected today. So that small introduction, let me just share my screen. In the next 35 minutes or so, I will take you through this topic with some examples and some sort of reflections, largely from the Ayurveda based research what we are doing here in TDU. But however, these examples or this research things that we are doing here with Ayurveda is applicable to all other medical systems or other medical traditions across India, as well as all sort of medical traditions across the globe. So let us start this one. Yeah. So let's start by defining what is medical pluralism. I think the word pluralism is basically a concept that comes from the social science background, or from a kind of non-science background, because in science most of the time find it comfortable to interact or integrate with areas that are rooted in similar epistemology. But pluralism is a coexistence of different worldviews. So therefore, if you see the definition of medical pluralism, it's employment of more than one medical system, or the coexistence of ideas, practices, and practitioners from several different traditions, and they are occupying the same therapeutic space in the society. So this is very important. So this is actually not a common phenomena that you can see in the hardcore scientific world. And there is one more way of expressing this medical pluralism, that is the coexistence of conventional and complementary and alternative medicine for improving health and wellness. So we call it as CAM, that is complementary and alternative medicine. But here, the problem is that the word CAM itself is, I think it's a bit confusing or contradictory. Why? Because when we say pluralistic medical approach, I think the concept of alternative medicine is inappropriate. Perhaps the pluralistic medical approach is itself is an alternate for whatever the other existing different medical traditions. Because we when we are not able to attain the expected outcome of maintaining health and wellness, so that is the time we look for alternative medicine, and that context, pluralism or medical pluralism is the alternate. But of course, the word complementary is very important because we need complementary approach from all these other medical traditions. So this is where the descriptions of medical pluralism by Charles Miller Leslie is very important. He is a celebrated medical anthropologist. He is the person introduced, coined the word medical pluralism. And he is an American anthropologist, and he had done a lot of work on Asian indigenous medical systems like Ayurveda, Chinese, Unani, etc. When I was referring to his papers and all those things, it's very interesting to see that the when he is giving the descriptions of medical pluralism, he used a phrase where biomedicines like Ayurveda and every other therapeutics. And he said that biomedicines like Ayurveda and every other therapeutics has some limitations. So this is a very interesting usage. What I understood from this usage is that Leslie did not consider biomedicine as just Western medicine, because that is the notion with which we use the word biomedicine in the current scientific world. If you refer the word biomedicine, you will always be directed towards the concepts of Western medicine, molecular medicine, and all those things. And we consider all the other medical practices like Ayurveda, Siddha, Unani, as well as the other Chinese medicine, etc., as complementary and alternative medicine. And also, he he basically included all this sort of medical practices under the broad terminology biomedicine. And also, Leslie said that every system of medicine generates discontent with its limitations and a search for alternative therapies. And he proposes that medical pluralism is an alternate for this. But as I said in the previous this thing, that all these medical traditions can play a complementary role. So this is the context and importance of medical pluralism. But now there can be a very interesting question. Is this different from integrative medicine? If it is different from integrative medicine, then how? So in my opinion, yes, this is different from integrative medicine because we have two predominant paradigms. One is the biomedical paradigm, as what I was mentioning, this biomedicine. And then we have the so-called complementary and alternative paradigm. So the issue with integrative medicine is most of the time there is a pressure to determine or to understand the mechanisms in mechanisms of complementary and alternative medicine in biomedical terms, and then to incorporate it into the biomedical framework and then practice it. So I think this is where the pluralistic medicine is different. Where in pluralistic medicine, there is always a more paradigm sensitive approach, and therefore it is, I think it is different from the concept of integrative medicine, where we are merely integrating different paradigms. So here, this is more of a coexistence, and it should actually evolve in such a way that there should be a complete merger so that it can be sort of like you will not be able to differentiate the different medical systems, and you will be able to see a real coexistence. Okay, so now the important question is like why is a pluralistic approach necessary? So this is one very important question, because we think that, as we were in the introduction, we were saying in the context of COVID and all, we started thinking about, can we have different approaches so that we can fight this sort of diseases. So we can see some sort of necessary for different medical approaches, and we can see the necessity of coexistence of different medical traditions. So, but why? What is the reason for that? So to understand this, we actually need to understand the definitions of some of these words like health, wellness, well-being, etc. So we know that World Health Organization has clearly defines health as a state of complete physical, mental, and social well-being. And it is not merely the absence of disease or infirmity. So, but again, the term wellness, we generally use that word in the context of physical body, and so that's why, you can see most of the time the wellness programs tend to focus on disease prevention and management. Okay, and also some time to identify the high risk individuals within a group and things like that. But the term well-being is very different, and that term expands the view of this wellness to cover more than the physical body, and it encompasses an individual's uh, uh, mental and emotional state as well, because these aspects are very important for the health, and what you call in Ayurveda, that is swasthya, that is nothing but swasthasya avastha. So this is something very important. So it is not just you are free from some sort of infection, I mean, or some sort of disease conditions, but you should also have a day-to-day feeling of, yeah, everything is going good, or everything is fine, I'm not having any other stress, and all those things is important to get that feeling of well-being. So similarly, the word disease is also very important. From a very general perspective, if you see the word disease, most of the time indicates issues like, that a person feel, or issues that a person faces physiologically and physically. And if you see the history of medicine, I think the 19th century discoveries are very important in the history of medicine. So before 19th century, that is before the introduction of germ theory of diseases, humorism was the basis for explaining the cause of disease. And actually, this concept of humorism was not only for complementary and alternative medicine, almost all sort of medical traditions across the globe, including the so-called Western medicine, and as well as the so-called complementary alternative. Every medical tradition had different ways of using this humorism for explaining diseases. And this you can see particularly in the case of Ayurveda, where we have concepts like Vata, Pitta, and Kapha. So this is one way of understanding the humors in the body. So, but after the emergence, or after the discovery, or after the proposal of germ theory of diseases, and following that germ theory of disease, there were pioneering works by Pasteur, Koch, and Joseph Lister. What we started understanding that, like, there are microorganisms which can cause all these diseases. So there was a gradual shift from the concepts of humorism to germ theory of disease for understanding the causative reasons or pathophysiology of disease. So in this process, we can see that the definition of health, wellness, and well-being are also started to get more focus, or they are people were trying to explain health and wellness and all those things in the context of germ theory. So because see, at that time the aim of a human being, or the humankind, was to uh, increase the lifespan and to avoid this sort of infirmity. So most of the death that were occurring at that time was because of infections, and we did not have a clear understanding what is happening in the body, because we are just seeing the manifestations, and we did not know what was the causative agent. So when we started understanding that, yes, there are microorganisms, so it's naturally people were forced to believe, like forced to think that all these health issues are because of this microorganisms. And also in the same 19th century, we can see one more different thing that, like, along with this germ theory introduction, actually this germ theory had actually revolutionized the science, because both medical science and biology as a whole lot of changes had happened after this proposal of germ theory. Deeper insights into the role of microorganisms and germs, not only in the human health, but also in the general environment, helped in the development of new dimensions for biology. But in medicine, this change can be seen as the development of specific things like, vaccines, antibiotics, and all those things. And all of you know that all these discoveries had actually helped in improving our lifespan from, something like, 35 years average to now it is 75 or so. And in this context of this, that shift from humorism to germ theory, kind of that context in the early to mid 19th century, we also need to discuss a couple of important people. One is Rudolf Virchow. So he was explaining disease as a manifestation of life process under altered conditions. So he was actually saying that disease have no independent or isolated existence. They are not autonomous organisms not being invading a body nor parasites growing on it. They are only the manifestations of life process under altered conditions. So this is actually a kind of a systemic view of understanding disease. Though there were germ theory introduced and people were trying to understand the infection and all those things, but at the same time, there are explanations like which are more matching with the philosophies of the so-called complementary and alternative medicines like Ayurveda, where a systemic understanding of disease. And he proposed that the disease can be viewed as a reaction of an organism to certain pathological onsets. So the link between pathological onsets and clinical manifestations is provided by a so-called what they are calling it as disease mechanism. So that process of disease mechanism, this is what is the concept that links the pathological pathophysiology and the clinical manifestation. So this was actually, I'm talking in the time that is 19th century. Now we all know what is molecular mechanism, what is disease mechanism, and we have different ways of understanding these things. But at that time, that was a new concept. So along with this, one more name is Claude Bernard. He's a French physiologist. Actually, he proposed that the concept of internal environment. So most of the diseases, according to him, can be understood as a reaction of an organism where some unbalancing is happening in the internal environment. So he's actually not really explaining what is internal environment in detail, but he's saying that there could be some imbalances in the internal environment, and that leads to these diseases. So this again fits perfectly with the systemic theory of life, and particularly when they say that the internal environment, I can easily correlate that with Ayurvedic concepts where the entire health and well-being is defined based on homeostasis. That's what they say, that all your tridosha, then your excretory process, then your digestive process, as well as your mind, and all those things should be always in a balance. That is what is the homeostasis. So this concept of homeostasis is proposed or discussed by Claude Bernard in the 19th century, and the same concept was there in Ayurveda, and you can see the similar concepts in other traditional medicines that are originated in different other countries like Chinese medicine or Japanese or other Oriental medicines and things like that. So also we have to see that it's the same time the same person, Claude Bernard, also introduced, who is the first person actually to introduce the objective ways of analyzing the scientific observations. And he introduced the concept of blind experiments. Okay. And so here now there are 2-3 things. Like one is that objective ways of understanding, and he proposed the concepts of blind experimentation, and we have the concept of disease mechanism. And at the same time, we had a lot of technological developments, like the microscopes and other tools and their introduction to the biology, so that the capacity of human to see the nature, or the you know these tools basically expanded the five senses in such a way that you can see very micro things. You can actually analyze different kind of sounds, or you can see internal organs and all those things. So all those things together resulted in a kind of a situation where people were more and more interested in understanding the mechanisms at a molecular level. Okay. So along with this improved or introduction of new tools and technologies, we had, because of that, we could actually understand the biology in a slightly different way. Like, we were able to understand the concepts of gene, protein, DNA, etc. So then we could connect the biological changes with that are happening with the at the level of gene, that are some things that are happening at the level of protein. So we were slowly understanding the importance of molecular mechanisms in the biological process. So this also actually caused the kind of a shift from uh, uh, the concept of humorism towards the molecular understanding of disease. And then when we had the importance, or when we had the dominance of this scientific methods and experimental proof for observations, so that also actually resulted in giving more importance to this kind of things, because these are the kind of tools which are suitable for the experimental approaches. Or if you want to provide an experimental proof, this sort of protein kind of things, or DNA, or those things will have a better chance to give that proof for that biological mechanism, for that scientific mechanism. So, and also in the same time, we had one more kind of a change in the overall medical field, that is the medical education that was started to get confined to the hospitals. So the hospital clinical education and the combination of this experimental methodologies, which was suggested by Bernard, then this actually resulted in a situation that the source of knowledge in medicine become experimental medicine and laboratory investigations. So what is the net result of this change is that the practitioners tend to abandon the other tools of knowledge, like ethnographic surveys, or the experience based knowledge generation, narratives, epidemiological surveys. All these things have slowly sort of disappeared from the field, and more focus was on specific experiments and laboratory studies and things like that. And also we had a kind of a hegemony or dominance of the one perspective of knowledge generation through this process. And that actually led to the development of molecular medicines. And then you can see this, the development into the current biomedicine. And then we had a very clear difference between biomedicine, which is more focused on this sort of a molecular. So the thick line that separates the biomedicine and so-called complementary alternative medicine is the molecular understanding. So what I was trying to say is this concept of medical pluralism is, in that sense, it's not a very new thing, because we were actually practicing some sort of a medical pluralism, but then because of certain what is that I can say, like certain social changes, certain colonial dominance and all those things, we had a situation where and the humankind is always interested to try out the new inventions and all those things. So we were in a position that okay, let us try and let us follow this, because this seems to be more suitable, and you will always get some immediate effect and all those things. And all this changes, all this experimental and hospital based medicine, this is more focused on disease management rather than wellness. So the other tradition were mostly focusing on the wellness approach, where this is mostly on the disease management. So that was also interesting for the general public. So this is where the first the change from the uh, or the from the pluralistic kind of a humorism based approach to a molecular approach that was happening. So now the question is, so in that what happened actually is like when we were discussing, or when people were discussing about a holistic or a more of a humorism based approach, there was a concept of healer. So from that healer kind of a concept, it changed to a practitioner, and then to a kind of a specialty kind of a thing, like a lot of specializations. And now we are in a time where we have super specialization. So all these things, though it was or though it is very important in terms of understanding the deeper biology of what is happening, deeper biology of the mechanism of disease and all those things, but we actually somewhere lost the kind of a healer kind of an approach, and we lost some sort of understanding things in a holistic way. So this basically resulted in compartmentalization of different medical systems, and also cost. I mean, it's an evolutionary process. We had, or we are currently facing some sort of difficulty in understanding different worldviews, and it's basically creation of silos. This is what is the net result of this. So now the question is that a problem? Like, why? What is the problem of this kind of a shift from a healer kind of an approach to a very specialized approach? So this is something we can understand by discussing that two prevailing schools of thoughts that we can see in the medical science. One is the holistic way, where we have, as we have discussed, the systemic way of understanding disease and health. And the other one is the reductionist way of understanding, where the focus is more on the molecular understanding. And there is actually one more school of thought, which we will not be able to, I mean, at least I cannot discuss this thing in detail, because I don't know much about this concept. That is vitalism, a force that is distinct from physical and chemical. So this is also pretty important in the medical science, though from a experimental perspective or from a research perspective, this is little difficult to explain, but that is also existing, and that's also very important. So these two prevailing systems are there. Now, how do we see these two prevailing systems? See, this is how we depict the holistic and reductionist way of understanding biology. So in the holistic way of understanding biology, we have the human body as a whole, which is sum total of its physiological interactions. It's a sum total of the body's interaction with the flora and fauna outside, which include the psychological interactions, and includes the physiological changes and all those things. And then from here, we have a gradual, reduction to the different components of this body through organ systems, organs, tissues, etc., etc., etc. So this is how we depict the difference between holism and reductionism. But what we need to understand here is, In each of these segments, you can see some sort of holism, and you can see some kind of reductionism also. For example, if you consider the organ system as a component of your human body, but that organ system can function as a whole, because there are also a lot of biological crosstalk and things like that is happening. And what we need to understand, though we have this holistic and reductionist way of understanding biology, we need to clearly understand that manifestation of health or manifestation of disease, that would be more than the sum of all these different individual interactions involved in it. So these individual interactions, when I say, that can be at molecular level, at cellular level, and even sometime at tissue level and organ level. So this is where the different perspectives are important. So as I was saying, like the introduction of new technologies and new tools that allowed us to, or enabled us to understand the deeper mechanisms in biology. So we were focusing on that, but at the same time, we have to understand that though those things are very important, the manifestation of health and disease is something much more than that. So as we always say in the discussion, that is 1 + 1 is not just 2, it is more than 2. So I will have to explain this manifestation in a way with example, with some observations from Hopkins that he proposed, or he published in 2008. He is kind of a first person who introduced the concept of network pharmacology, or he is a proponent of network pharmacology, particularly in the case of drug discovery. So what he is saying is that the reasons for new drug candidates being not successfully translated into effective therapies are more philosophical rather than technical or scientific. Because when we had dominance in the germ theory, when we had successfully used the germ theory for developing vaccines, for developing antibiotics and all those things, then slowly we had a concept that yes, the disease can be managed with the help of drugs, and drugs are working in a through a lock and key hypothesis, where the drugs will have a specific target on in some sites in the body. So that's how it was. And then you can see from that time onwards, the entire biomedical research or biological research were, particularly the drug discovery research, were focusing on identifying that kind of molecules. But later we realized that the number of potential candidates that are proposed and the number of candidates that are successfully translated to effective therapies are very different. It's a very small portion. So that is where this Hopkins point, like his concept, or this point of the reasons of failure is more of philosophical rather than technical or scientific. What he is saying is that the core assumptions that frame the drug discovery strategy are completely reductionist and not holistic. So to prove this, like he had several things. So I thought I will just take a small example from what we are doing here in our university with the help of certain Ayurveda formulations. This is example of an Ayurveda formulation called Disha Amaliki, which is a mixture of turmeric and amla. So what is that we are observing here? See, there are so many phytochemicals in these plants. So these phytochemicals can actually interact with, so what you are seeing here in green, blue, and orange color, these are the specific biochemical targets that are there in our body. So just from one plant, the yellow color is representing different chemicals from turmeric, and green thing, which is representing different chemicals from amla. So this many chemicals can interact with so many biochemical targets in the body. So all these targets are not only related to one disease. These targets will have relationship with several biological processes in the body. So the question here is, what is that that's happening in the body in terms of its crosstalk? Can we really see all these crosstalks when you look at only one part of the body, like one tissue or one cell or something like that? Because experimental research is most of the time focusing on this kind of cellular models and tissue models and things like that. And to complicate all these things further, these are all like, when I'm talking about the example of Nijamali, at least there's a physical substance which can be given to the human body and you can see the differences. But apart from this physical substances, there can be several other changes that are happening in the body, like stress or emotional changes and all those things. So all these changes will have a set of biochemical changes that are regulated by this emotional and psychological changes also. So this is such a complex thing, and in this kind of a complex scenario, this is where the argument by Hopkins is important. In this kind of a very complex scenario, if you are following just a reductionist philosophy for drug discovery. So here, when we say drug discovery, we have to understand that again in the current medical world or medical terminologies, drug discovery means you are identifying a molecule that can be given as a drug. But I'm using the word drug discovery in the context of a solution to manage any of these disease conditions. Okay, so his argument is that the drug discovery should not be focusing only on reductionist philosophies. It should have a little more holistic. Now, apart from that example of turmeric amla, so this picture what I have shown here is just specific to diabetes and diabetes type 2 diabetes mellitus. So that itself is such a complex thing. And now if you take just one chemical that is present in this turmeric, like curcumin, that alone has such a complex, you can see here, such a complex interaction in the body. So the point here is that this sort of complexity may be very difficult to understand at the level of, I mean, you will be able to understand this at the level of cells and tissues, but it may not be possible to perfectly correlate to the larger perspective, like the systemic level as well as the functional level and human body as a whole system. It may not be that easy. So this is the limitation, and this is where the kind of integrated approach or the pluralistic approach becomes very important. And the same kind of complexity you can see in the case of disease also, because you have different types of diseases, and in fact these different types of diseases are also interacting. It's not that diabetes can be treated as just diabetes, or it's not that epilepsy can be treated as just epilepsy. Every disease has crosstalk with other disease. Why that? Because that's the nature of the human body, because human body is not a compartmentalized thing. Everywhere everything is interacting, and people very well understand that many of these diseases like diabetes, obesity, otherwise can be considered as a physiological problem, but this also has a lot of relation with psychological aspects like stress, and also basically they are all psychosomatic disorders. And there are arguments that almost all diseases in the human body are in a way psychosomatic in nature. So how to understand all these things, because the models that are coming out from the molecular understanding and the reductionist view may not be sufficient to connect all these networks. So that's why I took this network as an example. So now this is the context. So to address this, what we need is we need to break the silos of different systems. Say for example, there can be a biochemical way of understanding things. There can be herb-based management of something. There can be some yoga-based, exercise-based, whatever it is. So, like the different ways of management of human health will be there. And we need to break these silos, and we need to understand these different views of different systems. And then we have to basically use all these things. We have to mix all these things. We have to make a framework where we can actually combine all these things, and we can transcend the functional boundaries. So then we can think of, one more reverse this thing, that is from this super specialties back to a concept of healer, because super specialty is required to understand and to provide certain benefits to the patients, but at the same time, that has to have some kind of a connection with the initially described healer concept. So that is where I think the medical pluralism forms important role, where the resurgence of medical pluralism can be considered. So this is what actually in our center in the Ayurveda Biology, as an example, that we are trying to do, where the same concepts of Ayurveda, that is more focused on the holistic understanding of the human body, and the biology, which is more of a more close to the reductionist way of understanding the disease. So we are trying to connect this. So for that, when you do this Ayurveda biology interaction, as an example I'm taking, it's a very challenging process, and this is challenging at various levels. So as a researcher, see, we can do the yeah, what is it, like, the integration or this merger. And so what, whenever we do a merger, or whenever we talk about a molecular, pluralistic approach, we have to actually prove that yes, this can be correlated. This is also understanding. So for that, we need to use different tools, but that's very challenging at various level. And the process of transcending the functional boundaries of different systems can basically have four key elements. Actually, these key elements are elements of any transdisciplinary approach as well. So you will have some social actors that are involved in the process of dealing with the concepts of pluralism. You will have technical artifacts that are available to address this question. So this is also very important. What sort of methodology I can use? Maybe it can be a experimental model. It can be a narrative. It can be sometime ethnography model, whatever it is, because that technical capability is also very important, and it plays a very important role in that. And the natural phenomena, sometimes some of these things may not be kind of, what I can say, like, may not be suitable to be explained with one method. So you may not be able to use the existing tools or existing elements to explain a particular thing. So you may have to identify that is a natural phenomena of that particular problem. So that's also very important. And you have to consider the ideas, concepts, ideologies, law, and all these things play an important role in this process of transcending the functional boundaries and breaking these silos. So the issues can be broadly classified or can be grouped into different things. One is philosophical issues. You can see sometimes linguistic issues, which may be more appropriate or more relevant in the context of Ayurveda kind of things. And you will have historical and cultural difficulties in connecting these things, and you will have sometimes societal issues, experimental at policy level. So at different levels, one person can see these problems. At philosophical level, and already we have discussed that certain medical systems will follow the concepts of holism, where they explain everything in the context of functions or the different systems. It will not explain the pathophysiology, or will not explain health and disease at a molecular level, whereas the other system will always see things at a molecular level. And then how to integrate these two things is one major challenge at a philosophical level. And at the linguistic level, you can see the usage of certain words that any word for that matter, when they use, that will have a philosophical context, and it will be associated to the scheme of knowledge that it is representing. But when you take that word and if you put it in a different context, you will not be able to interpret what the original uh, system, when they use that word, what was the intention for using that word, that will not be reflected in the other case. So the meaning of a word has to be interpreted and explained textually and contextually, where it had used, and we have to understand that context, and then accordingly we need to interpret that word. So it's a very challenging for a researcher who is particularly working in a field like Ayurveda and modern biology to draw parallels between the Ayurveda terms and corresponding molecular event. Most of the time it is impossible, and it's very difficult to correlate them to understand how this word can be used to explain the biology of health and disease. I just take one example, like Agni, or for example Ama, or just, so these are all very important, very significant words that are used in Ayurveda to explain the biological functions, to explain the pathophysiological action of pathophysiological process of different diseases, like Agni is improved, Agni is reduced, Agni Mandya kind of terms. But what is this? How a researcher or how a modern biologist can understand this? It's very difficult. If you simply translate that as fire or something like that, then it is not appropriate. Then we need to understand the concept of Ayurveda in detail and why they have used that word Agni. So you have to go back to the philosophical background of what is the Ayurveda's background. Like you may have to refer to Nyaya, Sankhya, and all those things, and where this word emerged and why that word is important in this context, etc. So that is a very challenging thing. So this is just one example, like Agni, and this kind of so many things you can see, even through dosha. You cannot actually find a direct correlation of Tridosha with any concepts of genetics or whatever it is. But this is though this is a limitation, this is one starting point. People can try and people can understand, and then people can work on that, how to correlate these things. But this is one major challenge that people can face when they work on pluralistic medicines and integrative medicine and things like that. And you'll also find some challenges with historical and cultural aspects, because most of these traditional medical systems, they will have some kind of religious and ritualistic beliefs incorporated into that. So this religious and ritualistic beliefs, again, they may not be directly correlatable with the molecular understanding or something like that, because these are the two different or dominant paradigms that we are discussing. So it may not be able to directly correlate with this thing. So what is the should we abandon some of these concepts, or can we take very useful information from this beliefs, and can we elaborate or work on that? And if at all we are working, how we will do that, and what sort of methodology we need to use, and can we have some kind of a descriptive ways of understanding this, and then making a pattern, so that can be say that yes, this is related to this particular condition. Otherwise, it will be like, yeah, just it's because of my belief I am getting cured of a disease, or because of my belief. That may not be acceptable by every people. So this is very much integrated into these kind of traditional medicine. So we need to clearly or carefully address this. And then some kind of legends like, yeah, this had happened at this time, and this person had cured this sort of disease. And maybe somebody can say that yes, any kind of cancer this person can cure. There may be some logic behind that. There may be some historical support for that, but we need to again, like our language, it has to be understood and identified contextually. So it may not be applicable or cannot be generalized always. And most of the time in this traditional medicines, including Ayurveda, we can see a lot of imaginations and dreams incorporated into that. So these are different from actual thing probably that would have happened at that time. It has to be understood in the proper way. Otherwise, like the kind of statements, if you directly take that and accept that, like everything is explained here, or this is the medicine for all sort of ailments. So it cannot be the case, because there can in the health and disease management, there cannot be any magic, in my opinion, because whether you are following a holistic approach, or whether you are following a reductionist approach, like systemic approach, or modern medicine, whatever it is, the body has a constitution which is made up of molecules and all those things. So this whatever that is happening at a functional level, there will be a molecular reflection for that. And also whatever is happening at a molecular level, that will have a reflection at the functional level. So a statement like the medicine for all ailments and all those things may not be acceptable. So if we are not really cautious about all these things, we may end up in claiming that yes, cloning was there, tissue culture was there, that was there, this was there. So these are the kind of issues that we can see in the current discussions when it comes to the pluralistic medical pluralism and integrative medicine, because this kind of claims, which which really leaves a gap that yeah, the other uh, uh, people, they will not understand that why, how they are saying, what is the rationale for claiming that this was there in this system. So we need to have a clear understanding that certain things can be kind of a imagination or dream when they have introduced that medical system, or when they have written that textbook. So that is one important challenge that to be resolved when we talk about pluralistic medicine. And then we have challenges at societal, experimental, and policy level, because the society, because of the dominance of one perspective. So, for example, in this context, the modern biomedicine, so always we have that kind of a pressure, that as what I was mentioning, and when I was discussing the concept of integrative medicine, that everything that we need to explain in the framework of biomedicine, and we need to understand that. And also then we attempt to juxtapose with other philosophical views as well. So these issues you can see at the experimental level also, because experiments are basically, the currently available experiments are designed to suit to the molecular understanding of disease. So that also may not be suitable. So you need to have different new experimental approaches to be designed for understanding these things. And policy level also will be influenced by all these things. And so the need of the hour is how to create a conceptual framework that can, you know, address all these challenges, and that will help us to move from individual medical systems to an integrative medical system, and then to a pluralistic medical system, and then finally to a kind of a transdisciplinary medicine. Because a pluralistic medical system, as I said, there will also have that separation, because it's more like a coexistence, and from there how to go to a transdisciplinary where we should have a complete merger of all these things. So the same healer can use all these different philosophies to treat the disease or to bring that wellness. And for that we need to have some interesting or very important transdisciplinary methodology that are appropriate to the specific questions that we need to ask. So this is what is the need of the hour. And uh, uh, with this small cartoon, I would like to conclude this discussion. And if we are not really considering the coexistence or integration or medical pluralism, probably we may fail to understand the concept of good health, and we may end up in a condition that we may try to see this good health also as a problem, and we may have to look for some treatment for good health also. So with that, I'm concluding this, and maybe I can
Thank you so much,
take
sir.
some questions. Yeah.
Yeah, thank you so much, sir, for the wonderful presentation. Before I request Meera to give her chairperson's comment and open the floor for discussion, I would also acknowledge that Dr. Pushya A. Gautam is also a part of the meeting, who is actually an Ayurvedic doctor. So we would also love to hear from her also if she has any points or any any questions. So Meera, over to you for your comments, and the floor is open for questions and answers. You can type your questions in chat box, or you can raise your hand. We can unmute you. Meera, over to you.
Yeah, thank you, Niharika, and thank you so much, sir, for very wonderfully and comprehensively putting across so many ideas about this. And I personally feel that as part of my research, I am researching on faith healing traditions in Kerala, specifically Mandravada, and how it is used to treat mental health. And much of what you said, especially the last parts about linguistic and cultural challenges, made so much sense to me. Where there also you can see that there is a mix of Ayurvedic tradition along with faith healing that happens. So these linguistic challenges that you said is something that I'm also working to understand, and the way words are used, the way words carry so much cultural meaning, and how it is different in different contexts. All of this made so much sense to me. So thank you for bringing all that out.
Thank you. Yeah.
And also, I think a very relevant point that you made was how there is so much mixing of superstition also that happens when we talk about alternative medicine, and how we tend to think in binaries. Either it is all superstition that there was cloning and all of that, or it is, we generally tend to take a very binary understanding of these things instead of an so it definitely was a very enlightening lecture, and I'm sure we all enjoyed it. So I don't have any questions at this point, so I think the floor questions, so perhaps we can take more from.
Thank you. I completely agree with your point, because as you said, it was the same thought that we have shared. Thank you. Thank you for sharing.
Rakesh will come to your question. I would actually request Dr. Pushya, who has an MBBS degree in Ayurveda and has many other talents, but we actually have an expert with us because she is the field of Ayurveda. I'll request her to speak. Pushya, over to you.
Yeah. Thank you so much, Niharika, and thank you so much, sir, for such a wonderful talk.
Thank you.
It feels so lovely to hear what you had to say about Ayurveda and speak so, I mean, scientifically, and also speak so comprehensively about the potential and the challenges that are associated with research in Ayurveda and also complementary systems of medicine. So these are things that I have felt through the course of my education, and these are things which I find so real. And echoing what Meera said about, I mean, where there is like a concept like Agni, a concept like Ama, or even a slightly abstract concept like dosha, it took the, the epigenetic study or the genomic study to say that there was a potential. But some of these things, they get lost in, is it a superstition? Is it an idea? And
I'm
how
very
does
happy
one...
that you use the word, abstract when you said the concept of dosa, because many people, when I discuss, they believe that it's a very absolute, thing that tridosha, that you can really see that, yes, this is the, like mathematics, you cannot see that in my understanding, but people think from mathematical perspective, and they try to correlate with certain aspects. I don't know how to address this, but you are absolutely right. It's a very abstract, and that's correct. That's a challenge. Yeah. Thank you.
Exactly, so I found it very fascinating, and it was also, I mean, you addressed the binaries of reductionism and holism, of what is science and what is non-science, what is pluralism, what is not. So these are a lot of things I'm left with. And so just one light, just very simple question, sir. So you were speaking about how, I mean, today drug discovery, which is a very large part of the Ayurveda industry, is extremely guided by reductionistic thought. So do you feel that there would be any way of bringing holistic thought or pluralistic thought into this process of drug discovery?
That's our dream, first point, because by saying that, I think, I'm clearly saying that it's not possible at this moment, and we are dreaming on that. And it is possible. And why it is possible? Because we need to see the problem, why that is not happening, because in my personal opinion, people are not seeing Ayurveda as a science that is experimented and then established in the country. Rather, they think that this is just a use of certain medicines or herbal mixtures and things like that. That's not the case. Since you are from that background, you know better than anybody that there were a lot of discussions that had happened, and maybe at the time of Charaga, or maybe at the time of Sushruta, or whatever it is. First point. Second point, what is my observation is, you can see that, see, Charaga's period, we are saying 5,000 years or so, and then till 16th century, there were a lot of changes that had happened in Ayurveda. A lot of improvisations had happened in Ayurveda. Why all of a sudden that is stopped? That's another thing. And the third point is, in a sense, though I used holistic and reductionist, and I use Ayurveda as a holistic, Ayurveda is not really holistic. If it is holistic, then they would have stopped with three doshas, like Vata, Pitta, Kapha. But they had gone further into that, and they would not have gone into deeper details of rasas and all those things. Because if it is just a superficial or systemic understanding, some of these things may not be required, like disease progression. So there was some reductionist thinking, but where it lost, I don't know. So it is possible, but what we need is a proper framework for discussing this.
Thank you, sir, and thank you, Dr. Pusha, for your enlightening comments. Sir, I'll request everyone to please switch on their videos if they don't have bandwidth issues, because it's a question answer session, and it'll be lovely to see everyone interacting.
That's true. Yeah.
So it's a humble request. And also, sir, we'll try to take more questions, and then we can see if you want to answer to them right away or later on. So I'll request everyone, if there are any questions, you can put it out in the chat box. Me and Meera are here to facilitate it. We'll read out your questions or unmute you to ask your questions. Now I'll request Rakesh and then Sukanya to ask their question. Over to you, Rakesh.
Thank you so much for this wonderful talk. I really appreciate the way you have analyzed and discussed. But I have two small.
Yeah. Rakesh, your voice is not. Yeah. Thank you.
Now I'm audible.
Yeah. Yes, please.
So I have basically a clarification in that sense when you talk about these dreams and they're like some kinds list to this like superstition in that sense and all. But when I was like reading Charles Laughlin biogenetic structuralism, he was talking about this polyphagic culture when he gives importance to this alternative state of consciousness, when he talks about the importance of dreams and then their importance in the healing process and all. In that sense, how do you see that the importance of when we talk about go for the indigenous healing tradition and talk about the healer, they give that how they got medicinal practices knowledge in the dreams and they are practicing now. So in that sense, how you connect this? And the second question is connected with that. You talk about disease, but disease, and then how do you define this sickness and illness when in their worldviews, which is very different from the biomedicine disease, which is more like bioaesthetic terms like we quantify and then do that. But illness and sickness has more like a qualitative kind of nature in that sense. When you, so how do you like see all these things in medical pluralism and then associate these things? Thank you so much.
Okay, so yeah.
So we'll request you to, we can take up more questions because we are running a little short of time. And as Sangeeta ma'am says, we should hear others also in the process. If you don't mind, sir, we'll take up some more questions and then
Sure.
answer. So
Sure,
can I
sure.
request you to please ask your question?
First of all, thank you, sir. I really enjoyed well because I can relate so many things.
Thank you. Thank you.
Yeah. So when you talk about this kind of healing rituals and all, I think that when especially we come about cultural bound syndrome, so they need at least some rituals to curing that. So what your perspective towards that? Because they are saying it is not originated due to the natural factors. It is originated due to supernatural. So healing ritual must be or should be there to cure that. It cannot be cured by modern medicine. So how you can like view on that?
Yeah, sure. Should I answer now or?
Yeah, if there are no further questions, we can take up the answers. Are there any further questions? You may please type it out in chat box or raise your hands. We will be able to unmute you. As of now, sir, I don't see any further questions. You may please answer.
Okay, yeah. So Ragesh, I will try to answer both your questions. So that dream, when I said when somebody is writing a text, like say for example Ayurveda or something like that, they use their dreams about like what is health and how it should be, and how they imagine what is wellness, and they will bring all those concepts into their descriptions. Like for example, if you do like this, you will have for example, like you will live for 100 years, or you will get energy of so many horses. This kind of descriptions will be there. So what I said was, it's not the dream how it affects your body. What I'm saying is, these sort of things, like let me put it in that sense. Like we say that what is that, like plastic surgery. There was plastic surgery, and there was evidence that people have done some kind of things. But just by seeing one example, you cannot generalize that every plastic surgery or every such attempts was introduced at that time. So this is what I meant when I said, we have to differentiate dreams and imagination that are described from the real thing. Because when you take that as a kind of an information or evidence, you may get misled in your experimental research, or when you try to understand what is the application of that science or that tradition, you may get some issues when it comes to the application level. So that was my point. And the second question, can you just repeat that if time permits, because it was not very clear.
Yes, so Kanya, I'm trying to unmute.
No, not Suganya.
Rakesh
Rakesh had a
Rakesh.
second question.
Yeah, Rakesh.
How do you see this? Like my question was related. That's like disease difference from sickness and illness. In that sense, how do you differentiate
No,
when you talk about?
yeah. So disease. See, if you see kind of a literary way of explaining disease as any uneasiness condition, and in biology we use two terms like disease and infection. When there is an infection that is associated with a microorganism or something like that, all the other non-infectious things can be included in disease as per biological definition. And I don't know, can we have a different definition for sickness and illness? In my opinion, that is also coming in disease as a broad thing, and then under infectious or non-infectious disease. This is what is my take on that. Okay. And Suganya, yeah, thank you for that. That's a very nice question, Suganya, the healing rituals. So what I said is, yes, healing rituals, everything is important in, health and well-being. If somebody want to, follow that, no problem. Healing rituals are very important. Not only healing rituals, you can have exercise based or yoga or whatever it is. Only thing is that when we try to understand, let's don't confuse that these healing rituals are working like a paracetamol or something like that. So healing rituals will have a different mechanism there. And don't replace paracetamol kind or crocin kind of a thing with a healing ritual, and then say that the mechanism is same. The disease mechanism or the management mechanism is, it cannot be same in my opinion. One will, I mean, you may find some correlation there also, like because you have a limited number of biochemical pathways understood. So one or the other pathway should work in ritual based healing as well as medicine based healing. So my only point is that we should be very clear that these are different and we should not juxtapose each other. That was my point. I think I answered that, right?
Thank you so much, sir.
Yeah.
Thank you, Rakesh and Sukanya, for that question. There is another question by Nanda Kumar.
Yes.
I'm trying to unmute. We can take one more question
Yeah, sure,
before the
sure.
formal vote. Thanks, sir, if that's okay.
Yeah, sure.
Okay.
Shall I read it out?
Yeah. Yes, Meera, please. Thank you.
Given the preponderance of Western allopathic systems, is there a possibility of parts of Ayurvedic system being digested by allopathy, leaving no trace of the source from which it is sourced, which is Ayurveda? A case in point is the example of patenting of the basil leaf.
If I understood that question, the possibility of parts of Ayurvedic system being digested by allopathy, leaving no trace of the source from which it is source, that is Ayurveda. Yeah, I think that
Sir,
is.
Nanda Kumar is unmuted. If
Yeah.
you can clarify the question, or if you want to add on to that.
Yeah.
Further.
Can I have a little more description on that question? I think it is possible, sir.
Yeah.
Shall I?
Yeah, please.
Yeah, okay. Basically, everything Western is seen as modern.
Yeah.
And everything traditional is seen as backward.
Okay.
Or mumbo jumbo. So, given this present day trajectory, where everything Western and allopathic is seen as the ultimate scientific, rational, reasonable way of looking at health, they are now, allopathy is actually, if I may say so, is no more allopathy. It's more integrated and more alternate forms joined up to it.
Yeah.
So in the process, basil leaf the tulsi leaf has been patented now, apparently. You can correct me if I go wrong.
Yeah.
And so in due course, they will scoop up as many good things as they can from the traditional Indian system, which is thousands of years old and time tested. So after some time, this knowledge will get digested into the larger framework of the so-called allopathic system. And it will even get a name, brand name from that perspective. And the source from which it is sourced, that is now Ayurveda, will be cut. The umbilical cord will be cut. And after a few hundred years, they will not even acknowledge that it came from Ayurveda. So is there a possibility that given this present trend?
Yes. So now this is my personal opinion, and this opinion is, yes, it is possible. And I feel that it is already happening, because whenever we discuss, I always try to differentiate between Ayurveda medicine versus Ayurveda inspired herbal products. Because there are so many herbal products that are, at least in the advertisements, you will see that they are Ayurveda products. But according to me, what is Ayurvedic preparation is, that should be compatible, or that should be working through the Ayurvedic principles of disease management, or Ayurvedic principles of wellness resetting. Otherwise, if you just because that kind of a plant, for example, tulsi leaf, if you take and that is used in some formulation according to Ayurveda, then if you take that and then if you prepare an extract out of that and put it in a and prove that efficacy through allopathic tools or modern biomedical tools, and then call that as an Ayurvedic preparation is not possible. So this is happening, and that's how this is taken from Ayurveda, but then they use it in the modern science context or modern allopathic context, and then slowly they will forget the root from where it is coming. First point, sir. And the second point is the basil leaf patenting. So for that sort of issues, now every country, particularly India, is very vigilant, and we have NBA kind of authorities like National Biodiversity Authorities, where they work for that, and they take care of that kind of completely patenting something and taking it away from the country. So that's not possible. I mean, here and there, that arguments will be there, but it may not be that easy. Did I answer?
Thank you, sir. I'll also request Nanda Kumar to give a brief introduction about his area of work, and then I'll request Dr. Pusha Gautam to please comment. She has written down some points in the chat box also. Sir, are you here, Nanda Kumar?
Yeah, I am. I was earlier working in the army. I was a colonel in the army, and I'm an associate of the NIAS, whatever that means, earlier days. And my area, I have no area of work as such. I do cross-disciplinary, interdisciplinary studies on various things, not on any particular thing. And I'm very interested in medicine as from the healing perspective, very interested in medicine. And so I keep delving into it. And a lot of cross-cultural knowledge I try to gain, in which a lot of things come across in this particular aspect of the Indic knowledge systems, which are being digested. And over a few thousand years, we are left with just the skeleton and no brand. Western, so-called Western modern, so-called modern science or bodies of knowledge have appropriated everything to themselves. And we are left with no brand. So, and slowly after a few hundred years, possibly there might be no trace of it left as a brand.
True.
So, case in point is yoga also. So yeah, this is just so there is the danger of Ayurveda not being even a science after 1,000 years, possibly. It might be called as some traditional thing which existed in this peninsula called India.
Yes, that's
and
possible.
It used to be called Ayurveda, and
that's possible, provided we if we are not really working hard to establish what is the real potential of that.
Thank you so much, sir, for that wonderful introduction. And it's great to know that you served in the army. So thank you for that, sir. I'll quickly request Dr. Pushya to give a brief comment. Then I'll request Meera for the formal vote of thanks. Dr. Pushya, over to you.
Sure. Thanks so much, Niharika, for giving me this chance. And I don't want to take too much time. Just a quick response to Mr. Nandakumar, sir. I fully understand and empathize from a very insider and lived stance the point of, your concern. And I think that there are two concerns here. One concern being, first questioning, first of all, what is science, what is non-scientific. And at the same time, while there seems to be, this overwhelming feeling that what is Western is scientific, unfortunately, what is not publicized is from the EU and the Americas. There has been collectively over $150 million US invested in Indian traditional knowledge systems and practices. So, though there are a lot of discourses regarding what is scientific and not, the money-making side of it and the misappropriation of Indic traditional knowledge has happened silently and in a very widespread and dangerous way. And secondly, regarding what you said about losing Ayurveda's identity, though I think one of its strengths has been its anonymity for so long. I think this is again something that the Ayurvedic community is grappling with at this point in time. How do you define yourself? Are you going to define yourself in the allopathic mode? And are you going to globalize in the allopathic mode? Or are you going to speak a language and hold your own, against these forces that otherwise tend to misappropriate and deprive you of spine and identity? So this is something that the Ayurvedic community is fighting with, and I thank you very much for raising that question.
Thank you, Dr. Pushya. I'll request Meera for her formal vote of thanks. Over to you, Meera.
Yeah. So thank you very much, sir, for talking to us about this very relevant topic.
Thank you.
It is our pleasure to hear from you. And thank you, Dr. Sankita Menon, for organizing this platform, letting us listen to so many varied lectures over so many. This has actually been a very good journey for Friday lectures also, because we have had so many varied speakers speaking to us. So thank you, Sankita ma'am, for facilitating this platform. Thank you, Niharika, for always facilitating it through Zoom as well. And Dr. Pushya, all the others, Rakesh, Sukanya, our team members who are such relevant questions, more interactive. And thank you everybody for being here today. And we will see you again with another Friday lecture next week. And I also wanted to say that if there are more comments or questions, we will be opening the WhatsApp groups for you. So, Dr. Vishnuprasad sir is also a part of it. Please feel free to ask your questions, or if you have further comments, please put them up as well. So thank you, everyone, and we will see you again next Friday.
Thank you, Meera. Thank you, Niharika, and of course, Pushya, Suganya, Ragesh, everybody for wonderful questions and for this opportunity. Thank you, Sangeeta madam, for considering me for this, and it was a very good experience for me, because generally we speak only about our research results, and very rarely we speak about a general topic like this, that too for a general audience. So thank you for this opportunity. Thank you.
Thank you, sir.
Thank you, sir.
Thank you.